Welcome to Grounded Wellness, your go-to podcast for simplified and trusted information on how to live a more non-toxic and holistic life. We're your hosts. I'm Bethany McDaniel, founder of Primally Pure, biohacking enthusiast and mom of 3.
And I'm Courtney O'Connor, holistic esthetician with over 15 years experience in the healing power of touch and holistic skincare rituals.
Have you ever been surprised by a cancer diagnosis, either for yourself or someone you care about? It's happening more often, even to seemingly healthy people, and there's a reason for it. Today, we're talking to Dr. Leigh Erin Connealy, the medical director of the largest integrative medicine clinic in North America. She's here to explain why cancer rates are rising, especially in younger people, and what we can do to prevent and treat it. Dr. Connealy's approach goes way beyond just treating cancer. She focuses on addressing the root cause and preventing it from happening in the first place. Let's dig in. Good morning and welcome to Grounded Wellness. Dr. Connealy, I'm so excited to have you here. Thanks so much for making the trek out to the farm.
Well, this couldn't be a better place. We're grounded in nature.
I know. And we have liver smoothies. We're drinking my liver smoothie recipe this morning.
And believe it or not, it does taste good. So don't be scared.
Yeah, the liver is well hidden with berries, mint leaves, raw milk. Well, you have quite the story of personal healing, and you also own the largest integrative medicine center in North America, and I want to get into all of that. But first, I want to talk about the epidemic of rising cancer rates, especially among young people in the United States. You have even said that 1 in 2 people will get a cancer diagnosis in their lifetime. What is going on and how did we get here?
Right. Well, we are in a serious pandemic of cancer because it's not just in the United States, all over the world. And the scary part is the incidence of, which is the number of new cases of cancer in young people. And even in children, it's not. So the number one cause of death in children is cancer. But now we have 18-year-olds, 20-year-olds, 25-year-olds, 30-year-olds, 35, 40 I consider young, with an explosion of cancer. And the current statistics are about 1 in 2 people have cancer. They say, I've read that by the time in 2030, they said 100% of people will have cancer. Now, that's probably not true, but I know that a very large cancer institute in California did their own independent studies because they are building a new hospital. So they wanted to study what the prevalence of cancer was, and they expected it to increase 30% over the next 5 years.
Wow.
So that is an outrageous number of people.
Yeah.
And Nixon declared war on cancer in 1970, and then every subsequent president has declared war on cancer. And where are we? And that really goes for the entire medical system, okay? Because there are more unhealthy, sick people than there are healthy people. If you look at our children, the babies first, autism in the state of California, it's 1 in 22. Elsewhere, it's 1 in 34, 1 in 37, okay?
And that is so much more than that number was.
Well, when I went to medical school,
decade ago.
we did not even really we had maybe a paragraph on autism.
Wow.
Now there's libraries on autism, okay? And there's autism centers. And with the outrageous increase, why aren't we saying, wait, stop, we got to figure this out, and we've got to prevent this, not treat it, okay? When first of all, there's no medicine for autism, okay? There's no drug for autism like there are no drugs for other diseases, right? And the medical paradigm is you get a drug, a surgery, or both. There's nothing really in between. That is what the paradigm is. And so, but if you look at children, our elementary kids, 60% or more have 1 or more chronic illnesses. Our teenagers have the highest rate of anxiety, depression, and suicide in the history of man. And then 25 and 30-year-olds are getting cancer. So obviously, everything we're doing is contributing. People always want to look for a magic bullet to fix something or one cause. Well, no, there's usually not one cause and one magic bullet for anything. I always use the analogy of chocolate chip cookies. If you forget the flour, you're not going to have chocolate chip cookies. So there's many, many factors involved in this outrage. If you just look at, first of all, okay, because I grew up a long time ago when life was really simple and much more natural and much more, people didn't have the food availability, the fast food availability like we have today. You didn't go to the doctor all the time. You rarely went to the doctor. You played outside. You didn't have technology. You had a very, very simple life. And now today, it's very complicated with technology and food that we don't even know what is in the food. Okay, you really need to be a forensic scientist to do like an analysis of everything that you're doing every single day, because I tell people every single decision you make is a healthcare decision. Think about it. Every single decision. Okay.
We say the same thing about skincare. Like what you eat is your skincare. Your habits are your skincare. It's not just what you're putting onto your skin.
Your skincare. You're right. Everything. So we all need to really kind of stop, take a moment of peacefulness and start being mindful and conscientious about everything we're doing. And that when we're saying doing, it's also everything we're thinking, everything we're doing, everything we're executing. We need to just really saying, is that beneficial to me? Is this going to augment my life and my existence? And so, but the causes, I think, for this outrageous increase, if you look at, first of all, your microbiome is about 75 to 80% of your immune system, all right? So now we have an attack on the microbiome. By one, we use lots of antibiotics, all right? People take antibiotics and doctors prescribe antibiotics for pretty much everything. And mothers go to the doctor and they really want antibiotics for their kid
instead of want a quick fix.
Yes, instead of nurturing the child and giving them things to augment their immune system, make sure their diet is good, etc. So that's really what a mother should do. I know I've had kids. I've never used an antibiotic on any of my kids, so I've done it before. So then if you look at what the average person is ingesting, so if you just look at your water supply, so your water supply is full of toxicity. Okay, you cannot drink your tap water. You cannot. I don't care where you are. It's not healthy. So it's got pharma water, so it's got pharmaceuticals, so you're ingesting birth control pills, chemotherapy, every kind
That's from people flushing medications down the toilet, right?
No, and taking them. They're taking them, and so think about it. So that's why it's very important what you put down your water system, because it's just being reprocessed. And yes. And then you think about, there's over 85,000 chemicals now allowed in the environment. You look at about all the insecticides, pesticides. I mean, the biggest thing is glyphosate, which is weed killer made by Monsanto. And I was reading yesterday or the day before, there's over 54,000 lawsuits now against Monsanto because of its cancer-causing effects. It started with lymphomas, but now I think they're finding that it has to do with many other cancers, because you're ingesting it and it's going to alter the microbiome. But that's just one thing. And if you look at paraquat and all the other insecticides and pesticides.
Are we getting anywhere with these lawsuits? Are they still just making so much money that it's not even phasing them? I mean, because I think by now so many people are aware of the dangers of Roundup, but it's still everywhere.
Yeah, it's still being used and it's still pervasive in our environment. And when we do the testing, we do environmental pollutant testing in the office, and it detects the concentration of glyphosate. And I would say mostly everybody has glyphosate.
Yeah, so hard to avoid.
Yeah, it's very hard to avoid. That's why your self-care is the new health care. Okay, you've got to learn how to take care of yourself and create this, protective universe in your own living sanctuary.
And kind of optimize detox pathways and do what we can to minimize toxins,
right?
That we can control, because there's a lot that we can't.
Right. So the other thing is, a lot of people are eating foods that have preservatives, flavorings, dyes, sweeteners, and other chemicals that they probably aren't even aware of. And some of the food isn't even real food, okay?
Right.
So if you think about all of that, your body has to, everything is like a QR code going into your body to turn on or off your cells, right? And for your cells to work for you, you have to have energy. And you get energy from nutrient-dense food, okay? And if you eat food that is basically taking away from you, like processed food, fast food, things with lots of chemicals, you're creating nutrient depletion and you're inhibiting your Krebs cycle of energy. So every doctor in medical school takes biochemistry. And part of biochemistry is something called the Krebs cycle. And Dr. Krebs invented it, and it's how your cells make ATP. ATP is the currency of life. And so if you don't have ATP, you're not around. And so your body's constantly making energy, but every single thing that you ingest, if it's not good for you, it's taking away from energy and straining the mitochondria. So the mitochondria, you have a cell, and inside the cell, you have these little powerhouse engines called mitochondria. And the mitochondria are your energy factories, and they make ATP, which is the currency of life. And so we're constantly now under attack between everything that we're exposed to. You have to err now on the side of caution so much because nothing really is great. If you look at the air now, I notice in the clinic that everyone has high aluminum, okay? So that's coming from
the atmosphere.
From the atmosphere, from the air pollution.
Wow.
Not to mention the nanoplastics, okay? All of us are loaded with plastics. If you look at the fish, you can look at all the nanoplastics and mercury. So you can't even eat fish. Fish is considered a great protein, but now when anybody eats fish, you can see how high their mercury levels are.
Yes, I remember that with my husband and I, both of us.
Yes.
High mercury,
So,
and he stopped eating tuna because he was eating tons of tuna, and the next time we came in, his mercury was down.
Right. So anyone, and I used to eat fish a lot, but when you see all these patients with elevated levels of mercury, which is very toxic to your body, all metals are, but you can't eat the fish anymore, unfortunately. Probably a scallop or shrimp or
Smaller
sardines.
fish?
Yes, the smaller the fish, the lesser concentration.
Because they
of
haven't accumulated all those heavy metals over a lifetime.
Right. So it's heavy metals and plastics, but there's plastics. So if the fish have plastics, we're not any different than the fish, okay? And so we all have to be just really very conscious about how we're living and do everything in our power, because everyone needs to make health their number one value. Think about if everyone made health every day, and it's not that difficult to make health your number one value, right? Mm-hmm. And because if you don't have your health, you yourself don't like yourself. Mm-hmm. You don't feel good about yourself. You're not happy, okay? You're not a good employee, okay? You can't run a company. You can't be a good family member. And more importantly, you can't be a good community member. And we thrive in community. And we're in an existential crisis in health. We're really in a precipice of just terrible, outcomes. And we've got to, everyone should be in public outrage about what is going on, honestly, okay? I've been doing this for 38 years, okay? So I started my medical practice with lifestyle medicine 38 years ago in Los Angeles, okay? I started with a dietitian, okay? And I interviewed a dietitian who had battled anorexia. And I said, what perfect person, okay? Because she's had the extremes. And let's face it, you learn from being sick yourself, mm-hmm. okay? I mean, that's how I've learned, is mm-hmm. going through my own curveballs and detours. And anyway, she was just amazing. So she and I were a team, and I focused on metabolism at that time, which was very, very long time ago. Nobody was even talking about
right.
that, okay? And so, and then, of course, I went from that to where I am today. And so we've always had lifestyle analysis as part of how we see a patient, because you don't just say, hi, how are you doing? Tell me about your family history and allergy. Okay, what's going on? Oh, I have a pain. Okay, a pain. Oh, well, you can take some Tylenol, ibuprofen, whatever.
Just matching up the medication with the symptom.
Yeah, exactly.
Yeah.
Let's do some blood work. Oh, I don't really see anything. And, okay, let me know if it doesn't come back. Okay. And so, but we never like, well, how do you sleep? How much water and what kind of water? I ask every patient, what kind of water? Because everyone must have some kind of water purification. Then I ask them, tell me what you eat daily. Breakfast, lunch, dinner. And then people always think, I eat healthy. They say immediately, oh, I eat healthy. And I'm like, okay, well, tell me what you eat.
Right.
And then when you examine what they eat, I go, well, no, you cannot eat like that. Let me tell you why.
Right.
You are driving your insulin crazy with eating all these carbohydrates for breakfast. And how you eat.
But the food pyramid tells us we need those 6 to 10, whatever it is, servings of grains per day. And as I hear you talking about these things, it's really, they're so basic, right? But we're so disconnected. Like you were describing life back in the day. We were outside, we were, in the sun, we were grounding, we were eating pure foods, like such basic things, but we've been so conditioned to just think that it's normal to do the opposite of all of that. And that's why, there's not just one cause for cancer. We're just living an extreme disconnect from the way we were meant to live, and everything is contributing to this rise in cancer. Is that kind of right?
Yeah, well, everything, you talked about being connected. So we're disconnected, connected.
Yeah.
Okay. Because, now you have your cell phone.
Right.
Okay. So you think you're connected, but you're really not. Because, back
Not
in the
to what we
day,
should be
people picked up
connected
the phone and then they met you on the corner.
Yeah.
And then you went to the library. And so people were connected. Now, today, I love having a cell phone, okay? Because it's a tool for me, all right? But I don't make my phone as a possession of my body and that I have to have it
part of
every
you.
minute. Yes, exactly. It's really a tool of technology. And I think you mentioned talking about being connected and disconnected, but the EMFs, the electromagnetic fields, are very, very serious, okay? We are electrical beings, okay? So I always tell every patient, you have these electrical fields coming from cell towers and phones and iPads and computers and everybody, all the wires going back and forth. It's creating lots of free radicals, all right? Not to mention, we don't really even quite comprehend all of the things that it's compromising in the production of our neurochemicals, our hydrochloric acid, all the things that we have. Our body's supposed to live according to these laws of Mother Nature that your body was born with, okay? If you think how your gastrointestinal system works, right? You chew your food, your body makes these incredible enzymes, then your esophagus.
In the saliva,
yes.
every part of it.
And then the esophagus has this natural propulsion to go to your stomach. And then your stomach has this natural movement to digest and absorb all your nutrients. And then it goes down to the small intestines, and then the liver, gallbladder, pancreas all chime in and produce all of these nutrients. And then the large intestines has this natural motility. And you're like, that happens because of electricity, all right? And so we have to think how we are living and ground every day, be in nature every day, because the Earth's magnetic field is how we recharge ourselves.
Yeah.
Okay?
And for anyone who thinks that is too out there, just go barefoot for 30 minutes a day and you will feel such a difference. Right. I know I do. Any time that I'm trying to wind down from a stressful day at work, I've been on a lot of calls maybe or Zoom meetings, I crave it now. I crave the ground, and I feel infinitely better after I spend time with my bare feet on the ground.
Right. Well, the nature is sentient, okay? And there's this treatment called forest bathing.
Yes.
Okay? So that's just immersing yourself into, the glorious trees and all the nature around you, whether it's flowers or plants or trees or anything. even animals, okay? They're energetic beings, okay? And so we now have artificial lights, artificial everything, and then we're all stressed out because of that abnormal environment every day. And so that's why you feel so much better. I mean, if you look at someone's blood under the microscope, once they ground, you'll see how much it improves.
Yes, there's actually changes.
There's
that take
actually
place.
changes because your blood is supposed to be like this free floating. It's a living organ, and it's just free floating all around. And when your body is stressed and not flowing properly, it all clumps together in what they call a rouleau formation.
Yeah.
And so it's just a beautiful thing that we're just not masterfully learning. We should all be masters of ourselves. And
I think we've all learned to just outsource that. Outsource, if we're feeling off, we outsource that. We go to the doctor, we get a medication.
Or we go get a Monster drink.
Right. We take the quick fix instead of really tuning in and assessing things and thinking, okay, what's out of balance right now? Like, what can I be doing differently?
Right. And then the other big thing that's influencing rates of cancer is being overweight and obese, okay?
And that's something that's even become taboo, with the whole body positivity movement, which I think is, there's some good in that. We shouldn't dislike ourselves and like sit in that place of feeling shame about how we look, but there are also real concerns with being overweight and obese.
Yes, because your fat is an endocrine organ in and of itself. So it stores toxins, creates inflammation, creates free radical, creates lots of burden for your body and for your body's organs to process.
I don't think a lot of people think of fat as an organ.
Yes.
And also muscle as an organ, right? Providing positive benefits.
Exactly. So, and we have really a tremendous amount of young people and older people, but a lot of young people, even children now are overweight and obese. And people, like you said, they like, oh, well, isn't it okay to be a little overweight? Well, no, not really. It isn't. Okay. Yeah. And so.
And it sounds like it kind of exacerbates things. Like if there is extra weight, that's going to produce more inflammation and
more storage of toxins, because your fat becomes a storage depot for toxicity. Okay. And then it's metabolizing every day. So all those metabolic wastes have to go through your liver to be processed. That's why so many people have fatty liver today. So fatty liver today is probably about 40% of the population. It's even in 10-year-olds already. They did a study in San Diego and found that elementary kids had a 10 or 11% incidence of fatty liver.
Wow.
And so that means if you have fatty liver, it means you can't metabolize what you're ingesting every day, all right? So then you can't lose weight, okay? You feel toxic, you feel swollen, and you're storing more inflammation. And I always tell patients that fatty liver, if you don't take care of fatty liver, it leads to cirrhosis. I can fix fatty liver, but I can't fix cirrhosis.
What is cirrhosis?
So cirrhosis is hardening and fibroticness, the liver shutting down. Like it has no capacity to take care of itself because it's just all fibrotic like a rock. And so it would behoove anyone, but the problem in medicine today that I see on a regular basis is that, one, it's underdiagnosed. And number two, if you get a diagnosis, because there's no medication for it, doctors don't discuss it with the patient, okay? And it's very easy. For me, it's easy to fix.
Yeah.
I know for, the average, doctor, they just don't know. In fact, I've listened to...
Just kind of ignore that,
yes,
put it on a shelf.
Yes, because I'm reading people's scans, and I'm like, oh, did you see it? You have fatty liver? And they look at me like, what? No one told me. And so I sit next to them and show them and highlight on the imaging that you have fatty liver. And I always try to, go a little extreme because I'm telling them, like, look, this leads to cirrhosis. And so, again, I can't fix cirrhosis, but I can fix and revert your fatty liver. You're a creature that is turning into good cells or bad cells 24/7, all right? You get a new body every 2 years. So if you're a living organ, so you can repair and regenerate and restore function back to your body. So you can see there's many different contributing factors, all right? And today there's no screening for cancer until you're really, a woman gets a pap smear, she gets breast imaging around 40, give or take, and now all the breast imaging is changing to a new technology called QT technology. So traditionally women get a mammogram. Well, mammogram is a imaging of your breast with radiation. They do ultrasound sometimes, and then they do MRIs. So there's problems with the mammograms because of the radiation, and for every 10,000 mammograms you save one life. And MRIs, there's the gadolinium dye, which is not really good for you long term. And in fact, now the papers, you sign a consent that, that if you, this may be a problem, and so you're signing that I'm okay with that. So anyway, but now they have new non-toxic, it's called QT technology, which we can talk about in a minute. So there's pap smears. For men, boys, young men, there's really nothing, okay? The first real thing for a man is a Cologuard at 45 years of age, okay? Because colon cancer is so high, now they changed from 50 to 45, and I'm like, well, what about all the 30-year-olds? And what about all the 35-year-olds? So we're missing all those.
There's that massive increase in the last decade or even less in young people getting cancer, but all the screenings are set up for when you're older,
right?
Sounds like.
So the screenings really aren't really working.
Yeah.
Okay.
And only one life saved for 10,000 mammograms.
Right.
Wow.
So in some countries they've said, let's do, especially I think Switzerland is like, let's offer other things, other types of imaging.
They tend to be ahead of us out there, right? Switzerland, Germany.
Yeah, well, they're much more a combination of more conventional with integrative options.
Yeah.
Okay.
Integrative medicine. I want to hear more about integrative medicine and what that is for anyone who may not be familiar with that term, and also your personal health story and how you ended up in the world of integrative medicine.
So integrative medicine is kind of a new buzzword and no one really understands it. So really it's kind of integrative, holistic with the WHOLISTIC medicine, and it's combining the best of conventional, because there are great things about conventional medicine. If you fall off a ladder today, the ERs in the US are the best. If you have a car accident, the ERs are the best, okay? If you're gonna have an imminent heart attack, there's nothing like a hospital in the United States of America. But chronic illness is a whole nother story. But conventional medicine is basically the doctor does a history and physical blood work, scans, PET scans. So we do have like amazing technology today that we can really look at the human body, and it's pretty amazing, okay? So we combine that, and let's say you had a serious infection, I would give you antibiotics. I wouldn't go, okay, let me make this natural potion for you, okay? So we have to use medicines in the right context, and you need to know the medicines in order to properly utilize them, okay? So if you came in for elevated blood pressure, for example, and I would say, we can't do natural right now today because it's your first visit. Your blood pressure is 200 over 120. And I don't want you to have a stroke because I can fix the blood pressure, but stroke, it's a long-term process. So here's the medicine. So how are you sleeping? Water, eating, et cetera, draw the blood. Are you 30 pounds overweight, et cetera, and all the contributing causes. And there's so many natural options to reduce blood pressure that you don't need medicine. But I would give you the medicine. I'll see you in a week. Let's see how you're doing. Let's start making these lifestyle interventions and then go from there. So that's combining conventional with, I call it new, updated, really medicine or healthy medicine.
Yeah.
Okay.
You're taking the good but using it in kind of a different way than most conventional settings.
Right. And so if I have a patient, for example, high blood pressure, which is quite common in about 30% of the population, I will get to all the root causes, but I usually will use an Ayurvedic herb for you to control your blood pressure, okay? And then I would get you on an exercise. I'd address your stress and all the other daily, how do you live 24 hours every day? And so that's what medicine is, not preventive, proactive, preemptive, or personalized in their approach. And that's the way we have to do it. In the beginning, it takes a little time, but think about, you launch a patient and then they are mastering their self-care themselves every day and executing what you are teaching them. Because doctor really means to teach.
Wow. There's not a whole lot of that happening.
No.
And how did you come to know all of this? How did you end up in this world?
Well, I did not pick it. It picked me. Okay, so I was born in the 50s in Texas, and my mother started bleeding. I'm number 3 of 6 children. Wow. And she went to the doctor, and back then they gave her a medication called DES. You're too young to know about that. That was called diethylstilbestrol. And diethylstilbestrol was given to pregnant women to prevent miscarriage and stop the bleeding. So fast forward, I'm a teenager. My parents receive a letter stating that that drug caused cancer in both male and female offspring, hormone problems, infertility, anatomical problems. So you need to go to a cancer institute right away. Well, I was living in Houston, Texas, went to MD Anderson Hospital.
And did you have any issues?
The worst thing, fortunately, I ever had was something called dysplasia. So you have normal cells dysplasia and cancer. And so I turned that dysplasia to normal, okay? And I have been on a mission of health probably ever since then. Of course, my early mission is very different than my mission today because, one, I've lived a lot of little things, okay? Like all of my children I never ovulated in my whole life, okay, by myself. I never had a period every month, ever in my whole life. And so I had to take fertility pills to get pregnant. Well, that didn't even work, so I had to go to infertility specialist. And fortunately, I was able to have 3 children. And so, fortunately for technology, it helped me, okay? Because when you have the desire to have a child, it's like, I got to have a baby right now, okay? It's like a crazy possession. You know? And so, fortunately, I was able to have babies. But I found hormones because I didn't have a regular menstrual cycle. So the doctors in the beginning wanted to put me on birth control pills. And I was on birth control pills. And I'm like, oh my God, these make me feel horrible. And so then I found natural progesterone. And I was forced to learn about hormones because hormones rule your life.
Yes.
And if your hormones aren't right, and I'm not talking about just female hormones, I'm not just talking about testosterone hormone, I'm talking about the orchestra of hormones.
So many.
And there's so many, and it's so complicated, and it's so critical to every single human out there to make sure your hormones are optimized because it will decide the decisions you make each and every day, okay? And so I'll just go through a little bit of hormonal just because we're on a little segue on that.
Let's do it.
So you have your thyroid hormone, you have your pancreas, which makes insulin and glucagon. Men have testicles, women have ovaries, and then there's the adrenals, and then you have your master hormone back up here with the hypothalamic pituitary axis. And so you have all these flooding hormones. Most doctors don't really know hormones. I'm only an expert out of default, okay? And only my own personal. And I tell people, reading a book and living it are 2 different things. It's like trying to explain to someone what it's like to have a baby. You'd never be successful until they have that baby. And then their whole life changed.
Yes.
Right. So I teach doctors on hormones all the time. I give lectures on it. It's not like I keep it a secret. I'm teaching all the time. Anybody wants to learn, I'm there to teach them. And so, but hormones rule your entire existence, your emotions, your thinking patterns. I mean, your mood, there isn't anything. And so you have to get that fixed.
And they're so easily disrupted by these endocrine disrupting chemicals.
Correct.
And there's, like you said, it's an orchestra. It all plays off of each other. And I think that most people understand hormones in terms of like estrogen, testosterone, and maybe people are thinking about cortisol or progesterone, but really there's so much more to the story.
There's so much more to, and they all work together. It's not like they all work separately. It's all this, they work all together in an orchestra. So for example, you know how you listen to an orchestra and you know how they, the strings play and then the percussion, so you see the difference. So that's exactly how your body is. So if you're deficient in one hormone, it's like a vacancy.
Throws everything off.
Yes, exactly. So hormones are just critical to your existence. I mean, you can't live, if you don't have your thyroid, you're dead because your thyroid is responsible for the voltage and energy of every single cell in your body.
Yeah.
And so unfortunately doctors, they learn it, but they don't learn it. Do you know what I'm saying? It's like my patient told me she had mold and she asked her doctor about mycotoxins and he looks at her like, what are mycotoxins? Okay, But that's kind of
Because
scary.
they didn't learn that in medical school, right?
Well,
They
you
learned-
learn it, but it's probably one day.
Yeah.
Okay. And then you never learn anything until you really have it. I hate to say
Yeah.
it.
And even then, I mean, the textbooks, you know, are outdated from the start, right?
Yes, that's right.
They're way behind the current research.
Exactly.
And a lot of the textbooks are influenced by pharmaceutical companies. So, and as you were talking about DES, I started thinking like how many of these interventions have been recommended over the years, only to
Find
5
out.
to 10 years later, we realize, oh, that was actually really bad.
Yeah, well, they used DES for 40 years knowing its oncogenic potential.
Wow.
Yes. Just like thalidomide. That's an old drug. You're too young to know that drug,
what's
too.
that one?
And it was a drug also, and the babies were born without arms.
Yes, I've heard of that.
Okay. So, and I mean, we're still making.
That's why it's so important to be your own advocate when it
Yes.
comes to your health and ask
and you
questions.
and you really need to avoid medications.
Yeah.
Okay. You have to
They should not be the first
It
resort.
can't be your first option to take care of yourself. It really can't.
Yeah.
Okay.
And so you've learned all of this by being your own experiment, and now you are helping so many people to optimize their bodies. And what about when it comes to cancer care? How does your approach, your integrative approach to cancer, differ from the conventional medicine approach?
Okay, so if you're diagnosed with cancer, so we have to understand that cancer is a 10-year disease. So from one cancer cell to a tumor is about 8 to 10 years. So that means we have 8 years of opportunity to prevent
Squash it.
Yes, to prevent this dreadful disease.
And that's not the typical understanding of cancer, right? It's kind of like they go, you know, notice a symptom, maybe go in, all of a sudden, maybe someone has a few months to live, and it's like, wow, you were so unlucky. This came out of nowhere.
Right. And in young people, they're being diagnosed at stage 3 and 4. That's usually the first presentation, unfortunately.
Yeah.
So that's, you know, very, very scary. And when they're already diagnosed, young children, I mean, young people, their DNA is rapidly dividing. So that means the cancer tends to be more aggressive.
So it can, wow. it
So
can be
that's the
actually
only
worse.
time being old is good for you.
Yeah.
So, but it's very aggressive if you're young. So that's why we have to completely change the paradigm. They really need to go back and really learn. But we're about 20 years behind. And so in our clinic, what we do, so if someone's diagnosed with cancer, surgery, chemo, and radiation are usually prescribed. Okay.
And
so
are those the only legal options for a doctor to give to a patient in a conventional setting? I'm not sure if that's true.
That's
I
a
heard
good-
something about that.
Yeah, that's a good question. Yes, you have to tell the patient what their options are, okay? And people are, you know, people do need surgery and they do need chemo sometimes and they do need radiation sometimes, okay? But I usually tell them, okay, yes, you need surgery, but we've got to take care of the garden and the terrain that this cancer came in.
Yeah,
okay?
I love this. Let's talk more about the terrain.
So you have to tell the patient everything because you have a responsibility to, an ethical responsibility. So, but in the conventional oncology, it's surgery, chemo, radiation. Okay, and that's what their toolkit is.
Right.
Okay.
They don't know
And
anything beyond that.
If you went
typically.
to Memorial Sloan Kettering or MD Anderson, they'd pretty much say the same thing, okay? Because there's something called the NCCN guidelines, okay? And ASCO. So they make up the guidelines, okay, for oncology. So, and sometimes I'm really for what the oncologist is going to do because sometimes you get cases that are so extreme and I have to combine the best of what they do with the best of what I do. So if you have cancer, though, and you use surgery and chemoradiation, there is a very high failure rate in solid tumors, okay? There was a study in 2018 in Journal of Translational Medicine, I think it was, that basically is a 90% fail rate if you just do that. So you can't just do that. You can't do. You have to understand why, where, when, and how, and get to why this is happening and why the terrain or the garden of every cell is not working for you to take care of you, okay? So what we do is I get all the information, look at the pathology, I look at everything the patient's experienced. I go over their life from in utero to where they are. So if they're 50, I say, okay, what happened every decade, okay? And then I go through sleep, water, eating, dental, because dental is huge, okay? Root canals, our infections, mercury fillings, receding gums, chronic infections, because your mouth is a gateway. So most doctors don't talk about the mouth with their patients.
And those things you mentioned, root canals and other things, can cause those lingering infections that
Correct.
weaken the immune system over time.
Correct. And then stress.
Yeah.
I ask the patient, so tell me what's been your stress for the past 10 years. So then I will order very expensive blood work. In typical oncology, they order a chemistry and a CBC. So a chemistry looks at your electrolytes, kidney, liver. A CBC looks at your white count if you're anemic and all your blood indices, okay, in your bone marrow. So, but what about all the other things?
Right.
The hemoglobin A1C, the C-reactive protein, the D, the hormones, the immune system, and it goes on. And there's blood tests for all this at LabCorp or Quest, okay?
And that's what I love about your approach. It is so comprehensive, and it makes me sad to think about the people that don't have, access to any of that. And
or knowledge. It's mostly knowledge.
And they go right.
Because you can go to your doctor and say, you know what, I read about this test. I want you to do this. I've read that these things affect. So, and if you don't find a doctor who will partner with you, you need to go to the new doctor.
Yeah.
Okay. Because every doctor should be in partnership with you and want you to heal.
Yeah.
Okay. And if they don't, you need to find a doctor who wants you to heal.
And it just makes so much sense. If you're not fixing the garden where the cancer grew, maybe you'll be able to eradicate it short term, but what's to stop it from coming back?
Right. So the garden that we have today, and that goes for really all of us, okay, none of us are exempt. We're all living in this universe. So if you look at what's inside our body, because, I measure it, so it's not like it's something I just think this up. So for example, heavy metals. And heavy metals, we were talking about earlier about mercury, but there's lead, there's cadmium, there's uranium, there's aluminum, okay? So these are so toxic to how your DNA is made every day. Then if you think about chronic infections, viruses, bacteria, parasites, and fungus, okay? A lot of people have a lot of them, okay? I'll be honest, most people, if I check most people have viruses. If you've had mono, the virus either goes attack, okay, and that's just one virus. If you have herpes or HPV, it's attack, okay, the immune system tries to get it. So viruses are asleep or awake, you want to keep them asleep. With what? An astute immune system, all right? And you're eating and all that kind of stuff. And then fungus. Well, a lot of people have fungus. How do we get fungus? Well, fungus comes from toxicity of the body and eating a lot of sugar and carbohydrates. You have this environment to grow yeast.
And what about moldy foods or a moldy environment?
It's moldy environment more than anything, okay? And they say that 95% of buildings and homes probably have mold, okay?
Wow.
Because they don't build them the same way they did a long time ago, all right? So
we just dealt with the whole year-long mold situation.
Right, well, and then let's face it, a lot of homes have leaks in them and they just don't know it.
Yeah.
If you don't go and look, you don't find. It's
not always visible.
And so you have to know, because mold is so immunosuppressive and takes over and suffocates your cells. So when you have low oxygen from the suffocation of the bugs and all the toxins, what happens is your body makes acidity, and then acidity interferes with the energy body, the Krab cycle of energy that your mitochondria make. So you just have this constant vicious cycle. So we all have to purify our bodies, okay? We all have to get rid of the bugs. There's all kind of natural things to get rid of bugs, okay? And then eat foods that nourish and strengthen and heal our body. Cleansing, sauna, it's been around for a very long time. I've had a sauna in our clinic for over 25 years, okay? The Finnish have been doing it for a very long time. In Europe, I went to speak at the Integrative Medicine Week in Baden-Baden. They have spas everywhere, and the whole family goes. It's like what you do after work, is you go and you do sweating and the special waters and everything, and that's
that's
what
so
you
good.
do. I
And
mean,
there's studies showing that saunas decrease all-cause mortality by like staggering numbers.
and that's a simple thing to do. So people, like, probably the greatest investment you can make in your health is sweating with a
That was the first
sauna.
big health investment we made, and it's paid off tenfold.
Right.
Yeah. So you're addressing the full lifestyle, full health history, all of these things, encouraging people to eat better foods, drink pure water, detoxify their environments. What role do the products we use play in our health and our system?
The products you're talking about, skin products that women
Skincare
love
products,
every day.
cleaning products. Yeah.
Yeah, well, remember, every decision you make is a healthcare decision. So whatever you're cleaning your stove with, your counters with, think about it, going inside your body. You have to think about that, because what are you going to do? You bring out an apple, cut it on the counter, so it's getting in the apple, right? So everything, I always think about your shower water, okay? You got to have a shower filter, because you're bathing and your skin is very large organ absorbing all of the chlorine and fluoride if you don't have a shower purifier, okay? Then you have to think about the products you're using, like your soaps, your shampoos, conditioners, and women love their products.
Yep.
And so we've got to make sure that they have products that are not intoxicating. You just got to think that your skin is eating this, okay? And they've done studies that if women use pure products, the chemical load is less and less, effect on the body.
Yeah, I think people think sometimes if it's not something you're ingesting, it's not that big of a deal. But like you said, it is. There's proof of it. There's certain medications that are applied to a skin as a means of absorption. So it really does make a difference. And the average woman applies 168 different chemicals to her body every single day. That's a lot of chemical accumulation. So with breast cancer, which as we know is the #1 cancer, and this month in October being Breast Cancer Awareness Month, I just can't help but think about how much awareness there has been surrounding breast cancer, and how that has really gotten us nowhere in the quest to eradicate breast cancer. Why do you think that is?
Right. It's so true, and we've allowed it to just now proliferate even more. And I think, first of all, our medical system has no prevention. Okay, young women have, I said earlier, we have no screening for women, a 25-year-old, 30, but the first time it recommended any kind of screening between 35 and 40, but we've only had mammograms and sometimes ultrasound as a tool to look for cancer. So now we have brand new breast cancer screening, and that's called QT, quantitative transmission. You basically put each breast in water, and they run sound waves through the breast to detect the tiniest little mass now.
Wow.
And they do each breast. It takes about 30, 40 minutes, depending on the size of the breast. There is no radiation, there are no dyes, there is no toxicity. It's a brand new FDA. It's not really brand new. It's actually been around, but like anything new, it takes years to get into the medical system because it's FDA approved now. And so, but that's going to be the new way. And I think young women don't get screened early because their breasts are dense, and mammogram isn't good on dense tissue, right? And over 50% of the population has dense tissue. So you're going to miss it. You're going to miss 50% of the cancer. So you've got to do an ultrasound. But now that we have QT, it's going to be a far better option. It's 40 times the resolution of an MRI.
And is this something that a lot of oncologists are utilizing, or not really yet?
Not yet. It's like anything new that comes out. I
so
learned
long.
about it by 2 breast surgeons who stopped doing breast surgery to now focus on prevention of breast cancer. So, which is great, because here these people were chopping off people's breasts, okay? And now they're really on the mission to get this new screening, non-toxic screening out to the public.
That's amazing.
Yeah, and then there's nothing talked about, really, when you talk about all these breast cancer philanthropic groups, they don't talk about prevention.
No.
All they're talking about treatment, and then they have pictures of women lose their hair and all this stuff. And I'm like, wait, that's not what I want to go through, right?
But that doesn't create a lifelong patient.
Yeah, right.
You don't get a lifelong patient or a lifelong customer, for the pharmaceutical companies if we are preventing. And when we think about these organizations that are so focused on, quote, breast cancer awareness, what is that even doing?
Yes.
Like just being aware of it, and they're raising money, but all of that is being sent to pharmaceutical companies to develop new drugs. So they don't have any interest in preventing it.
Right, exactly. Because if you think there's a drug called Avastin, which blocks angiogenesis, which is blood supplied to the cancer. And then they said, oh, it's the greatest drug, but it doesn't extend life, okay? And really none of the treatment protocols today, very little extend life, unfortunately. So,
and a lot of times I think people decide it's not even worth it to go that route and experience all of these symptoms for the remainder of their life.
Well, it's a very invasive process when you undergo these treatment protocols.
Yeah. And another thing that I think has gotten a ton of awareness is skin cancer. Awareness about sunscreen use is at an all-time high, has been for decades. Meanwhile, skin cancer rates have continued to skyrocket. What are your thoughts on that?
Well, it is the number one cancer is skin cancer, okay? Solid tumors is breast, but skin cancer in and of itself is the number one cancer. So there's basal cell, squamous cell, and melanoma. And people, yes, you're right, people lather on sunscreen. I personally don't use sunscreen unless I'm going out for a very long period of time.
Same.
But your first hour, you should not have sunscreen. You need to let the sun enter your eyes and through your skin, because remember, light is life. And most of the sunscreens sold are toxicity, okay? And so you shouldn't be using chemical sunscreens at all. And then melanoma, people think that it's caused by the sun, but it's not, because if you think when you get diagnosed with melanoma, it's on an area of the body that sun doesn't even get to.
Yep.
So
I have a friend who does that. She tests the cells in skin grafts and finds melanoma, and a lot of times it's not in a place where the sun ever touches.
Right. So sun is medicine, okay? And light is life. And so we're now avoiding sunshine, but sunlight needs to be part of our daily life. I try to go out in the middle of the day and go take a walk and get sunshine.
Yeah.
So the light
I have a lot of bones to pick with dermatologists, because I had a negative experience with a dermatologist for acne in high school, and being prescribed antibiotics after antibiotics to treat my acne. So many things that I think they're getting wrong, and I think sun exposure is another one. This idea that we have to wear UPF clothing and cover every inch of our body every time we're out in the sun. It's just so flawed. Obviously, we have to have a healthy respect for the sun, and we don't want to burn, but that's not going to happen within the first 5 minutes we get outside.
Right.
We want to experience the benefits of the sunlight and the vitamin D, and then we can go in the shade when we need to cover up. We can wear sunscreen when we're out in the sun for long periods of time. Yeah, but like you said, not a chemical-based sunscreen, something like zinc oxide that's going to create that physical barrier. One more question. Vitamin B17, it's not considered a vitamin in the U.S. It's not allowed in the U.S. What can you tell us about B17?
Well, B17 years ago, there was a study done at Memorial Sloan Kettering and showed how it worked, and then of course they got rid of it. And so it is actually a nutrient that is looked at in the testing that I do to see if it's going to kill your circulating tumor cells. So it's one agent that has the possibility of killing circulating tumor cells. And so, but there's many agents. So, years ago, there was a doctor who had a clinic in Mexico, still exists, and he used to be my former partner. And they used B17 for everything. And it worked. It got rid of people's cancer. But today, we're living in an environment that
you need more.
Need way more bullets in order to kill cancer.
Yeah, that's very interesting, though.
Yeah.
What about apricot seeds?
Yeah, apricot seeds is B7.
Yeah,
it's where the B17.
It's the highest form, right?
Yes, exactly.
Yeah, I just started taking those.
Yeah, so we use those apricot power in our clinic. That's what we use, is the seeds to give to patients.
What are some of the next level things that you offer at your clinic for cancer patients?
So one of the things we do, so if a patient needs chemotherapy, the only time that I recommend chemotherapy is if people have tumor burden. So a little lump typically doesn't need chemotherapy. Are there extenuating circumstances? Yes. You have to look at the pathology to see if a patient warranted. They have special tests now called mammoprint, and they tell you if chemotherapy is going to help you.
Okay.
And so, but 70% of breast cancer patients don't need chemotherapy. But if it's already gone outside of the original location, and it's gone into your lymph glands or to your liver, your kidney, or your bones, we know we have to shrink the problem from here to here, okay? So we have to use something. Now, if patients don't want to do chemotherapy, yes, there are other things they can do. I always tell people, I don't negotiate with cancer.
Yeah.
I want you to do everything. I will take care of the downside, but right now, we're 10 years behind. Let's institute. So in our clinic, we do something called fractionated chemotherapy. So cancer cells have something called insulin-like growth factors. So insulin is what responsible for sugar to the cell, right? And so cancer cells have more than a normal cell. So we prime the body by giving your body insulin. So it turns on the insulin-like growth factors. We bring your blood sugar to something called the therapeutic moment, which is about 40. And then we give you the chemotherapy so they're ready to eat it. So the insulin's like a Trojan horse to bring chemo to the cancer cell, preserving the other cells.
And you have them fast prior?
Fast the day before and the day of, because they found at USC in a study that if people fasted, their side effects were 50% less or more.
Is that just because autophagy is activated?
Yes.
And your body's more primed to
And it
get rid
doesn't
of
have
those
to
toxins?
do exactly, and it doesn't have to do anything else.
Yeah.
Whereas if you're eating and everything, it's consumed with taking care of what you're ingesting. Okay?
Yeah,
So if you're in
amazing.
fasting, your body's in a cleanup state.
Yeah.
Right? So we always have, whether you do conventional or you do fractionated, I tell the patients to fast the day before and the day of. And I've told patients to fast for other reasons too.
I'm curious, would you recommend, I've heard, I think Dr. Thomas Seyfried, I'm not sure if I'm saying that correct, but he recommends like a 7-day fast every year for everybody. Is that, like, what are your thoughts on doing periodical fasts just to do some cleanup?
I think it's really good. I think I always ask patients, have you ever fasted? Yes, no. What can you do? What do you think you can do? Some people say 1 day, some people say 30 days. The longest I've ever had a patient do is 30 days.
Wow, that's a long time.
I don't really advocate that, but I partner with the patient with what they think they can do and what they want to do. And I have seen it do incredible things. But like, for example, if a patient wants to lose weight, I'll say, I want you to fast 2 days a week. And if I can't get somebody's C-reactive protein down and getting their triglycerides down, I will tell them, look, I have seen this change. And I've also seen that help people lose weight. Because, I would say a large percent of the population is trying to lose weight.
Yeah.
So we got to look for all the tools to help them lose weight.
And I think a lot of people would think that, oh, not eating 2 days a week sounds extreme, but really when you understand how the body works and that the body, you can burn your own fuel when you're not consuming food, it's really not that extreme at all. And I'm a fan of fasting. That's why I'm curious about this personally, because I just think it's so fascinating and amazing how the body can do so much when you just give it a break from digesting foods. And I've experienced profound benefits from periodical fasts in my life too.
Right. Well, there's a great documentary called The Science of Fasting. If anyone has any questions, concerns, and wants to see the science, it's fabulous.
Oh, that's great.
Now, the other things that we do, we recommend hyperbaric oxygen and or ozone. So we do ozone intravenously. And because cancer, we know, Otto Warburg got a Nobel Prize, that cancer is a anaerobic, sugary, acidic environment. And so I got to change all of that.
Yeah. So it thrives in lack of oxygen, high sugar, what was the
and
third
acidity.
one? Acidity.
Right. So we give them things to alkalinize their body. We use them a special powder of sodium potassium bicarb. Then we do, like
is that baking soda?
It's
mixed
like
with
baking soda. So I started out with baking soda.
Yeah.
And I tried it myself, and I was like, oh, I don't know if anybody could do this every day because it just doesn't taste good. So I found a product that is magnesium, sodium bicarb, and it tastes so much better. And then, of course, I have them do either detox baths with clay and Epsom salts and baking soda, or infrared sauna, depending on what they have. So,
and what's the ratio of?
So I usually do a cup of 2 cups of Epsom salts, a cup of baking soda, and a 1/4 cup of clay.
Yes.
So
It feels amazing.
Yeah.
I noticed that when I do the detox bath, I sweat like almost as much as I do with a sauna. It's really powerful.
yeah, and your skin, believe it or not, is a purification organ.
Yeah.
Okay. And then ozone is very, very synergistic with chemotherapy. So, but ozone, like I do a blood test called PHI, which stands for phosphohexoisomerase. It's an indicator of anaerobic metabolism. So I know that if patients' numbers are really high, I need to give IV ozone, or I use something called EBU. EBU is where we hook you up to a machine, and it's a closed unit, and we put your blood through a filter, and then we ozonate it. So
And it goes back in purified.
Exactly. So that's another thing that we do. We do PMF on everybody. Every person that has a human magnetic field. And so because of all these factors that are draining, everything's a lack of energy and voltage, right? So PMF is pulsed electromagnetic field. So all of them either lay on it, their whole body, and or the body part.
Okay.
And then I use light therapy. So I use light. It's called photobiomodulation. So light is light. All of your cells have light. They have a photonic light, believe it or not. And so we intravenously will give you a substance like, say, curcumin, which is like turmeric. And then we use the lights, all the different lights, 5 different lights, to activate the curcumin to work in your body. All right? You can use it as a standalone to help because it works on many different levels to add energy to the body, antimicrobial, and it's incredible. Okay, now you can also do it topically. Like I use it topically for skin cancers. So instead of making a scar, you will do it topically by applying a substance to activate the pathological tissue, and then it's laser on top, and then it just fries it.
That's
and
incredible.
It goes off by itself.
Do you ever use ozonated olive oil for skin cancer?
Oh yeah, I use that for many different things.
Yeah.
It's a phenomenal healer for scars.
I think that's another thing that everyone should have at home is an ozone generator.
Yes, a lot of our
They're not
patients do.
that expensive.
Right. Yeah, they're not that expensive. Right. That's why that's the self-care, kit that would be helpful for people to have. So we check the voltage of every single person. So the voltages I talked about earlier, I say this is a big deal because it's like energy. You have to have energy for every cell to work. So we know that you're not making good energy because you have cancer, right? So you can't heal if you don't have energy. So if you were to have surgery tomorrow, you're going to need energy of your cells to heal from that surgery. So we check the voltage of every one of our patients, and then we charge them. We have something called the biocharger, and then you sit in front of and receive frequencies, and then we have something called the biomodulator. So we'll charge the patients once or twice a day, and then sometimes when they go home, we give them essential oils to continue it unless they want to do the biomodulator themselves.
Gosh, that's so fascinating. So for anyone listening, I am a patient at Dr. Connealy's clinic. She has the Cancer Center for Healing and then also the Center for New Medicine. So my husband and I became patients at the Center for New Medicine earlier this year just for optimization and just general like healthcare stuff. And that is one treatment that I have been looking forward to getting. So hopefully one of these days we'll get in there for it.
Yeah.
But I wish that every oncologist thought like you and incorporated all of these things, because this epidemic, it's not going away. It's getting worse and worse and worse, and we're just throwing more of the same things at it.
Yeah, and we're not, the results aren't any better.
No.
Okay, if the results were better, it's great, but the results are abysmal.
Yes.
Okay, and the human suffering that we see is unnecessary. So, but doctors, they don't know anything different. They have nothing else in their toolkit to help cure and heal a patient.
Yeah.
So So they've got to go back. Now, are doctors, yes, are there doctors going back and learning? But there's no like weekend year course to learn all this. It takes,
It's really up to them.
it's up to the doctor to take control of their own lives. But there are doctors that are functional doctors, but
Hopefully more.
cancer is a whole nother level, meaning of prevention and treatment. And so that's something that people have, the doctor has to learn, or the practitioner has to learn.
Yeah.
But you can. It's not, it's not that difficult. It's, I always think I'm not going to find something on PubMed, but sure enough, there's always the answer, a scientific article written about it, whether it's mistletoe or whatever it is, hyperthermia. Hyperthermia is another thing that we use. Hyperthermia is elevating your body to elevated temperatures. So we make 3 heat shock proteins, 27, 72, and 90. And this is why sauna is so good, because heat kills viruses and cancer. And so we use hyperthermia at the clinic on a particular part of your body to elevate, not just the body part, it'll elevate the body to kill those cells.
That's incredible.
So we'll add that also, because when you have cancer, you better have as many magic bullets as possible. Never rely on just surgery, chemo, and radiation, because the biopsy is injurious and immunosuppressive. The surgery is injurious and immunosuppressive. The chemo is injurious and immunosuppressive, and radiation. So what are you doing to counteract that the whole time? So there's something called circulating tumor cells. So circulating tumor cells are responsible for 95% of metastasis. So surgery, chemo, and radiation makes those cells very upset and makes them, want them to go to a new home, nest, or residence. And in the United States, very few doctors check circulating tumor cells. There's 5 articles a day on PubMed on circulating tumor cells. They're performed all over the world. But in the US, if an institution does not have their own lab, they just don't check them. Another blood test that's relatively new that I've only been using in the past year that is available in the United States. So let's say you had a diagnosis and you want to make sure that it's still silent. There's a blood test called Signatera, and that's looking at circulating tumor DNA, which is DNA that's broken off from the original tumor. So that's another test now we can use for prevention if you've had cancer. It doesn't work for prevention to prevent cancer. It's used to monitor you if you've had cancer. It's amazing, and just arm yourself with information, reading. There's a book called Outliers, and what does it say? 10,000 hours to become an expert. And so we need to learn how to be an expert on ourselves.
Yeah, there's so much out there, which I think gives a lot of hope that, there aren't just these 3 options of chemo, surgery, and radiation. There's a lot more. And if your doctor isn't, in the know about anything beyond those 3 conventional options, like you said, maybe it's time to find someone else to establish care under. But how would someone find the right person near them? You're in Southern California, your Cancer Center for Healing and Center for New Medicine, but for those who are living in different states, maybe don't have the means to travel to California, where would they start in finding someone to see?
That's a good question. Well, first of all, we do cancer conversation every 2 weeks, okay? So you can listen, and it's recorded. So if you miss it, you can listen to it. So then you can find a doctor or start looking for a doctor that is doing things that we're doing, okay? Then just Google, there's the Institute for Functional Medicine. There's different groups of medical groups that are into integrative functional medicine, all right? And always partner with a medical doctor or a naturopath that knows the best of both, okay? Because if you do have something, I have seen patients that they've been seeing a practitioner and it was way worse than they thought it was. And so but the practitioner didn't know that. Mm-hmm. And so you want to make sure that you're, A-okay, okay? You got to make sure that practitioner really knows, okay? And because we're talking about cancer, and so cancer is a complicated conundrum, all right? Other diseases are a little bit easier. You can take your time about the investigation. But cancer is something you want to, 1, prevent, and if you are treated, You want to make sure that you're armed with all the information modalities, but a lot of it is something you do at home. You know, there's a great book called Radical Remission, and 8 out of the 10 things that these are people were all given a death sentence, and 8 out of the 10 things were things they did on their own.
Wow. Let's talk about that a little bit, because I know we've talked about some really doom and gloom statistics with 1 in 2 people now receiving a cancer diagnosis in their lifetime. I know I've also heard you say that 90% of sickness and disease is caused by diet and lifestyle. So like you said, a lot of it are things that we can be just practicing in our everyday life. And we've talked about a few things like infrared sauna, the detox baths, the baking soda. I know I do half a teaspoon of baking soda at night. Is that a good amount?
Very good.
And you have the other mix that tastes a little better. But what are some other just small tweaks and small little hacks that people can tap into to prevent cancer and just improve their health overall?
Right. Well, I would say the number one thing every human being needs to be cognizant of is their state of mind. And there's a book called The Body Keeps Score.
Yeah.
And everybody has a journey. Some people have worse life experiences, but mostly everybody has some kind of trauma and drama. I don't think I've ever met somebody who doesn't.
No one's exempt from that.
No one's exempt.
Yeah.
I've never, I mean, I listened to people's stories for 38 years. I've never said, oh, this person's perfect. Oh my God, they don't need, I've never met
no
that
emotional
person.
distress.
So everyone has it, and address it, okay? And don't become a victim, become a hero of your journey. And learn how to do that. Don't become the problem. I always tell people, 2 cardinal rules. Don't become the problem, don't own the problem. Everything is a learning episode, and learning episodes are not short, and learn all the lessons, okay? Go help yourself and help somebody else. But really set your mind, okay? Be in a PMA, positive mental attitude, each and every day, no matter what curveball's thrown you, okay? And I'm a very spiritual person. I grew up Catholic. I don't practice Catholicism now, but I have a very deep spiritual practice, and that's how I live. I don't know how other people can live without that, because it has a central role in how I function 24 hours, 7 days a week. And so I always turn a problem into an affirmation of gratitude, okay? And a gratitude, affirmation that's going to happen now. Not that's gonna happen, that's going to happen now. So that really does my system really good. And that's what we all need to do. And just be in constant affirmations of gratitude. Like, thank God I woke up today.
Yeah.
Thank God I have 2 feet and I can walk. Thank God I get to drive a car. Thank God that I have a toilet and a shower and I have food and I can make coffee, and just these basic things we need to be thankful of.
Absolutely.
Because many people around the world, the 8 billion people, a lot of people don't have what we have right this second, okay?
Yeah.
And then just really be in that and reset during the day. And if you have an issue with a mom, dad, rape, any molestation, anything, go get help for it and learn how to turn that negative seed into positive seed. Years ago, I remember I was driving to work and I was listening to Thich Nhat Hanh, and if you don't know him, look him up. And he was a Vietnamese Buddhist, and the cassette tape was about how to turn negative seeds into positive seeds. And I looked, that just so resonated with me, and because I didn't have a perfect childhood, and so I didn't have a father figure in my life, and I was always trying to be A++++, okay? Because I wanted my dad to recognize me. But then I wouldn't be who I am if that didn't happen.
Yeah.
So your negative seeds
There's
become your positive seeds,
Yeah.
your weaknesses become your superpower, literally,
Yeah.
okay? And so I now, I look like everything that happened to me made me that elevated, enlightened person, okay? And I get like this, I could spend hours on, because it's something, the battlefield of the mind is real, and it's 24/7 with every single person. There's not a soul that doesn't have it. We're not robots, okay? And so it's something that you really have to just constantly re-engage, because we get pulled over here, there, and all the nonsense, and then we got to get reset. Then how do you live every day? Okay. So what are you eating? Okay. We can't be eating food that's dead.
It's not food.
Okay. We have to eat real food. It's not that difficult and not that expensive, okay, if you do it correctly and analyze it. There's so many people that write about this. Then water, like I said, you have to drink purified water. You can't, and use glass. Get rid of plastic out of your life everywhere. Ziplocs, everything. When I had my kids, I wrapped everything in wax paper, paper bags, never used all the other stuff. And so just get rid of plastic, okay? That's like one thing in my book I talk about. Just get rid of plastics. We're just inundated with it. And then move your body. We are living in a world that nobody's moving. We have 800 muscles.
Sitting is the new smoking.
Yeah, and we're not moving. And so use every opportunity to move. Don't send an email to someone. Go talk to someone. Say hi to them. Oh, I want to tell you about something. We got to get this done. Don't send an email or a text. Go do it yourself. Okay. Enjoy washing dishes. Enjoy washing clothes. Enjoy walking up and down the stairs, and use every opportunity to move. Okay. Yeah. Every single thing, because we're not moving enough. And then you have to have a purification routine. Okay. So a lot of it's at home. You have a sauna, but not everybody has a sauna. So you need to do a bath. You can do a skin brushing, okay?
Yeah, dry brushing.
Start with the feet.
What do you think about castor oil packs?
Castor oil packs are phenomenal. They've been used for, years and years. It's the wonder oil. It's great for your hair growth. If you need hair, it's great for your hair growth, your eyebrows. I put it on my eyebrows every night. And you can do jumping. Yeah. Like a little jumping, mini trampoline is very good for your lymph circulation, because your lymph removes the garbage out of your body. It's 4 times greater than your blood circulation. So, and you can do jump rope. Okay, yep. You don't even need to have a trampoline. Just good old jump rope.
There's so many free options,
right,
too.
Exactly. And then I always call them exercise snacks. So I always tell people, just get up and do this 10 times.
Yeah.
Just, like weird little things you can.
That's what I do when I've been like just sitting for a while working. I take a break and I'll do 20 air squats.
Yeah, exactly. So just use your body. I saw somebody on TV the other day, they were doing chair yoga. Like there's people that can't move and do chair yoga. And I was like, oh my God, that's a phenomenal idea. Like, and it was perfect. So there's always something out there for everything.
Lots of options.
Right. And then make sure you're optimized nutritionally. Like there's very easy ways to look at your nutritional status. In our clinic, we use something called OligoScan that looks at the intracellular concentration of your vitamins, minerals, and heavy.
Where the finger.
Yes, and it's very fast.
Yeah.
So because if you don't have the optimum nutrient, your cells are dying. And then if you can't do that, just look for the most comprehensive natural replacement, okay? The most comprehensive thing that you can find. And do your own research. Do your own, I always tell people, don't take my word for it. Go look up everything I tell you. Go find it, you'll find it. And I remember I was telling you earlier, I had this lady doctor who came to see me, and she was a young doctor and had melanoma. And I was like, she works for Kaiser. And I'm like, wow, does she know where she is? I mean, I'm the opposite of Kaiser, right? And so then she told me that, I said, well, why did you get interested in integrative functional medicine? She goes, I started studying doctors talking about integrative functional medicine, and I thought, they are full of it. They don't know what they're talking about. And in my quest to prove them wrong, I realized they were all right.
Oh my God.
And that I have to go unlearn everything that I'm learning. And so that's where we are. So, and it's not just for medicine. Take every facet of your life and really bother yourself to go read, educate, discuss.
I think that is an underrated thing. Just this idea of engaging your mind and learning, being on a constant path of growth has to be so beneficial for your health overall.
Right.
Yeah.
And then most people don't sleep well.
Yeah.
Okay. Make sure you're getting 7 to 8 hours of good sleep, and really try to get out in nature as much as possible.
Yeah. Basically, live like people lived 200 years ago.
Yeah, exactly.
And you'll be good.
Not even 200, about 100.
Even that, yeah.
Even when I was a little girl, it was pretty.
It's gotten worse and worse.
Yeah, it's gotten
in the last
worse
couple of decades.
Right. Mm-hmm.
Yeah. Well, I love what you said so much about our mindset and our thoughts. You know, the Bible says hold every thought captive. It's easier said than done, but I think it's so important not to believe every stupid thought that jumps into your brain. Half of them aren't true anyways, and just kind of constantly reframing things from a place of gratitude, because there's always something that we can be grateful for.
That's right.
Yeah. Well, thank you so much for joining us today. This has been such a cool conversation, and what a treat to just have you here for an hour and a half and to be able to chat here at the farm. So I really appreciate your time. Where can people find you, follow along with you, and continue to learn from you?
Well, they can follow us on Instagram, Connealy MD, and then you can look up the clinics, Center for New Medicine and CancerCenterForHealing.com. And then you can read my book, The Cancer Revolution. I'm coming out with the second book in beginning of 2025. And then listen to Cancer Conversation and everything else every other Tuesday. So we're constantly educating, inspiring people to live better lives.
Wonderful. Thank you so much, Dr. Connealy.
My privilege. Thank you.